My name is Lorne Brown. I'm from Acubalance Vancouver in British Columbia, Canada. I'm the clinical director there. Doctor of Traditional Chinese Medicine, Fellow of the American Board of Oriental Reproductive Medicine, certified laser therapist, clinical hypnotherapist. And I'm excited to offer this presentation to you to share with some of the stuff that we're doing at Acubalance. I think I have a lot from the public here and a few colleagues and practitioners here. I do want to let you know that just a short disclaimer here that this is for educational purposes. This is not intended to be medical advice or interpreted as medical advice. This is meant just for educational purposes. If you have a health condition or working through your fertility, please do seek out your healthcare provider. So I want to talk about the laser for fertility, laser acupuncture fertility. I'm going to share a bit of my journey. I do want to let you know that people often ask, I was asked today, what's the difference between laser acupuncture and traditional acupuncture? So in general, when you put pressure, use your hand and massage an acupuncture point, we would call that acupressure. If you insert a needle into that, we'd call it acupuncture. And that box on the bottom left, if we use heat, we call it moxibustion. And if we put photons, light, laser, packets of energy, which is what laser is, photons, that's called laser therapy. Now, I have an interesting journey that I want to share with you on how here at Acubalance of Vancouver, we've been using the laser for fertility, both in people trying to conceive naturally and helping to improve both egg and sperm quality to get to that better embryo quality, as well as for uterine receptivity before and after an IVF transfer. Now, you may hear this term laser for fertility or laser. The terminology that I'm talking about here, or the type of laser, is called low-level laser. And that scientific term now, they often call it photobiomodulation. So if you've heard of cold laser or low-level laser or photobiomodulation, we're talking about the same types of laser systems I'm talking about. What this is not a high-powered laser that can burn you or cut you like you'd see in surgery where they do incisions with it. It's not the kind of laser that's really painful that you use for hair removal or those types of lasers that people use for sculpturing, to sculpture the face. So these are low-level laser therapy, non-invasive, not painful, non-heating types of laser. And it's been around for a while, at least since the 70s, where they've been using lasers. It started with wound healing. So lasers are used now, or photobiomodulation for wound healing. Think of diabetic ulcers or just wounds that won't heal properly, or to just accelerate wound healing. Pain and injuries. Pain and injuries is the most common use of the lasers. Rheumatoid arthritis, dementia, and Alzheimer's. And then obviously what we're going to talk about today is being used more and more, and there's more research coming out for infertility, male motility, polycystic ovarian syndrome, endometriosis, dysmenorrhea and pelvic pain, in an IVF setting, for endometrial receptivity. So these are just some of the things that lasers being used for. Now, I first learned and got interested into laser back in around 2008, 2009. There was a study that was published on using laser acupuncture before and after an embryo transfer. And so already there have been over 6 to 8 years of research on using acupuncture before and after transfer. And this abstract, this study, what they did is they had a group that received laser acupuncture. They had a group that received sham lasers. So the laser actually wasn't a real laser. It made a noise, but it didn't do anything. It wasn't really working. And then they had an acupuncture group and a control group. And the group that had laser acupuncture had a 15% increase in implantation. So after hearing about that abstract, I was able to talk to one of the reproductive endocrinologists that were involved in that study. And I also spoke to some of the acupuncturists involved in that study. And at Acubalance, we purchased that laser, the same laser, and used it in the way they used it based on the feedback and the advice and recommendations they gave us. So we started using that on site before and after embryo transfers. Well, as time passes, we were just using it on transfer day, and we'd use it a little bit in the clinic before we really learned how to use it for other conditions. It was mainly just used for IVF. And we played with it a bit in the clinic. And then I came across some papers that were published or talked about in the 90s. So this was way back when this was published, where a medical doctor from Japan, Dr. Oshiro, and I title this "Great Discoveries Are Often by Accident," because he was a pain doctor. He was a medical doctor that he treat pain using laser therapy, low-level laser therapy. And he talks about a case where a woman had back pain. She was 55 years old, in menopause. And although he resolved her back pain over a series of laser treatments, she was upset that her menstrual cycle returned. He dismissed it as a one-off. But another case where a woman who was in menopause receiving laser therapy from him for her back pain, it also brought back her cycle. So out of curiosity, in his hospital, the gynecology department decided to do what's called a pilot study. So a small study, 74 women, where they did laser therapy for them. And the English translation for this group that they did out of Japan, they called it severe infertility. This is because these women on average were 39 years of age. They experienced infertility for at least 9 years, on average 9 years. They'd been through on average 15 ART cycles, so IUIs, medicated IUIs, and IVFs. And in this group, they had about a 21% pregnancy rate of this group that was diagnosed as severe infertility after years of trying ART cycles. And 68% of that group had a live birth. So they expanded and they increased this population size to about 701 women. In that group now, the average age was 39. Rather than 9 years of infertility, it was 4 years. They had done on average 8 cycles of ART. And they had about a 22%, so very similar pregnancy rate. And that group had a 50% live birth rate. So that got me thinking about, hey, how can we use this not just for endometrial receptivity? Because when you're doing acupuncture or laser acupuncture on transfer day, we're not doing anything for embryo quality at this point in time. On transfer day, that embryo is already in the lab. So all we can be helping with is uterine receptivity. And this was interesting because this was doing treatments leading up to the IVF or trying to conceive naturally. And so somehow are they impacting the egg quality as well as the uterine receptivity to make hopefully better embryos and obviously live birth rates. So I continue to be interested in the laser, experimenting with our clinic, talking to colleagues. And I came across in this book, The Brain's Way of Healing by Norman Doidge, there was a chapter on laser for brain injuries. But in it, Dr. Fred Kahn, who used to be a vascular surgeon, he had his practice practicing out of Toronto, Canada. He talks about using the low-level laser therapy because of its effectiveness for softening scar tissue and reducing inflammation, increasing blood flow, that he had many women that didn't need to have surgery in the end because of using the low-level laser therapy just on the skin and on the sacrum that would reduce their pain and inflammation. I later go and talk to another medical doctor who's also trained acupuncturist, laser therapist in Australia, who's using laser therapy for her patients with endometriosis. And she anecdotally said that many of her patients that had infertility endometriosis went on to become less pain or pain-free and go on to conceive naturally. And so the journey continues. And then I read a paper, and this is not a study, this is just a self-reporting paper by the group called Paramedics out of Denmark. And their clinics of a lot of the clinicians, they asked them, what's their success rate with treating women with their laser? So you can see a picture of that laser there. It has a large surface area. And they make some crazy good claims of improving success rates. So I later get to talk to Clinic 8 there with the 171 treated cases at that time, Anne-Marie Jensen, and learn how she was using her laser, the Giga laser. And I get curious at this point because why maybe they have a better success rate? Well, the Oshiro, the medical doctor out of Japan, he mostly did laser therapy around the neck area. And there's a reason by how it increases blood flow and increases the parasympathetic response. So it sends blood everywhere. So he thought that maybe they're improving their fertility rates with their laser system in Japan because of its tremendous effect of increasing blood flow. When you look at this success rate, again, not a study, but hey, they have pretty good results here. I'm thinking maybe, why is this improving it so much? So it is a stronger laser. So they had a more powerful laser than they use in Japan. So maybe that's part of it. They were treating locally. So rather than just the neck, they treated over the abdomen, over the ovaries. They also had a much more frequency of treatment. So in this group, they treated their patients during their follicular phase 6 visits up to ovulation, from bleed to ovulation. So basically, they were recommending 3 treatments a week for those 2 weeks, which I also think I can understand and see the benefit. And we often do that at our clinic at Acubalance. And it's a much bigger laser, so it could cover more areas. So all this started getting me very interested in the laser for therapy. This is Anne-Marie Jensen's book. I was able to read her English version and write the preface to that. And she has a lot of her book is dedicated to using low-level laser therapy for treating fertility. And also she talks about some of the body work she does. At our clinic, we like to combine low-level laser therapy with acupuncture, as well as we have a nurse that does the abdominal massage. So that's the body work to replicate kind of what Anne-Marie Jensen does in Denmark. So what is the mechanism behind the laser, and what can it be doing? So here in general is the mechanism behind laser therapy. And I'm going to discuss each one in a little bit more detail, but just in general, this is the science. This is why it's helping with wound healing, why it can be helping with dementia, why it helps accelerate healing and reduces pain, and how can it be helping with fertility. And so photobiomodulation, when the cells absorb the light, it can increase the mitochondrial function. So the mitochondria produces more ATP, which is energy. And the mitochondria are like the batteries of your cell. And so in fertility, especially when we get to advanced maternal age, one of the theories is that maybe we're having poor, like abnormal embryos, so chromosomal issues, or we're not having implantation, is because the mitochondria are wearing out as we age, and it takes a lot of energy to have that cell division in the fallopian tube or inside or to implant into the uterus. So whether it's in the fallopian tube or in the lab, in the IVF lab, that embryo development, that division takes a lot of energy in the lab or in your own fallopian tubes. And the implantation takes a lot of energy. And this is one of the things Dr. Oshiro talked about in his summaries of his research is not only the blood flow, but if we can improve mitochondrial function, then maybe we can help these women that are having a wearing out of their mitochondrial function, because we need that energy for embryo division, cell division, and for implantation. It increases blood circulation. So more blood flow to the ovaries, more nutrients, more oxygens, hormones. If you're doing IVF, more of the IVF drugs, more blood flow to the uterus. So hopefully the uterus will be thicker, richer, and more receptive for implantation. It's been shown to regulate inflammation. This is why I like it with PCOS, endometriosis, and why it's such a wonderful tool for pain. It can lower oxidative stress. So think of that as body rust. Oxidative stress, free radical damage is negatively impacts egg quality and sperm quality. Can soften adhesions and scar tissue. And in some mouse studies, it's shown that it has a synergy with certain nutrients like coenzyme Q10, so for that absorption. So this is the mechanism behind it. This makes sense. Okay, if we can do all this, this is great for our cellular health, which the egg and sperm are cells. And so this is kind of the mechanism behind photobiomodulation in general. Eventually, I get to talk to Dr. Nakamura out of Japan. He's an acupuncturist that works in IVF clinics. And they've been doing a combination of acupuncture with photobiomodulation. And what they had shared is they saw a doubling of the blastocyst rate. And so somebody did some IVF cycles, and then they did some laser therapies after those IVF cycles before they do another one. Even though the patients were getting older, they started seeing increase in how many blastocysts these women would get. What I thought was fascinating and I really enjoyed was At this point at Acubalance, we started to come up with our protocol, pioneering how we're going to use laser therapy based on talking to colleagues, clinical experience, and looking at the research. And our approach, both the acupuncture for increasing blood flow and the laser, was very similar, which is excited me in that they've been doing this for 10 years longer than we have at Acubalance. So they have this 10 years worth of data where they've been seeing the doubling of blastocyst rates. I will share now, just to digress a minute, we go to on-site for all of IVF before and after embryo transfers. We do that on site, and we do a combination of both acupuncture and laser. And they looked at the data of women that had transfers at Olive that were frozen, that were genetically screened. So these were all embryos that were chromosomally normal transferred, and they compared them to those that had Acubalance versus did not have Acubalance. And those that had the Acubalance, the laser and acupuncture on transfer day, had a higher pregnancy rate and a lower miscarriage rate. And then when they looked at more of the data, we saw that those that had 7 or more treatments leading up to the transfer, plus the transfer day treatment, had a much higher pregnancy rate and lower miscarriage rate. And so again, that's just looking at uterine receptivity, because the embryos were already tested and in the lab. So nourish the soul before you plant the seed is kind of a concept in Chinese medicine. And I want to tie this into laser therapy and just in general, what you can do to help optimize your fertility, get your fertility to its peak potential. And I'll share a little story around my metaphor around this and how it relates to fertility. And if you had a plant that you neglected and it looked like it was over, it was time to toss it into the garbage or the compost, it looked dried out and dehydrated. Oftentimes you can add water to that plant, maybe add a little fertilizer, change its positioning of how much sunlight it's getting. And in doing so, this plant's able to regain its vigor and give off fruits and flowers. Now, you never change the roots. You didn't do donor roots, right? You didn't do anything to the roots. All you did is optimize the soil. So this plant always had the potential to give off fruits and flowers, but because the soil was suboptimal, it wasn't reaching its peak potential. And so when you're visiting us at Acubalance or any Chinese medicine doctor or naturopathic clinic, we're always looking to make your soil, your environment optimal. And I want to share in general what laser can do, but other things can do, because laser is not the holy grail. So don't think, oh, if I just do laser therapy, I'm solved. Unfortunately not. We still have nothing that is the end all by be all, right? It is an integrative, holistic approach, meaning your diet is key. So diet's important. Your lifestyle, adequate exercise, moderate exercise, adequate rest, deep, sufficient sleep, stress reduction. All these things are important. Adding supplements to your diet. These are things that can support your fertility, help you reach that peak fertility potential. So when we talk about some of the mechanism, it stimulates the mitochondrial function to produce more energy, I mentioned, right? Well, think of the plant again. Plants take sunlight and convert that sunlight into energy. We call it photosynthesis. Well, our cells take red and infrared light, and we convert that into energy. That's what the mitochondria like. So the laser's like giving your cells sunlight. It's helping recharge the mitochondria, the batteries in the cell, which helps with repair. It slows down cell death. Okay, it increases cell survival, which is really important when it comes to sperm and egg quality. This is the reason you're taking coenzyme Q10, many of you. CoQ10 is, again, an antioxidant to help improve mitochondrial function. So this is another way to improve that mitochondrial function. We want to increase blood circulation. So from our garden analogy, this is increasing blood flow. We're watering the soil, right? We're watering this plant. And so we want blood flow. So acupuncture is an excellent way to bring blood flow to your ovaries. Stress reduction helps with that. Some body work, femoral massage, exercise, and then low-level laser therapy and acupuncture. Excellent ways to bring blood flow to your reproductive system. Very important, because as we age and as women age, the blood flow to the reproductive system declines. So we want to do everything to slow down that aging process. And so increasing blood flow is important. It can help regulate inflammation. So think of inflammation as the pH of your soil. And this is important because we don't want to have inflammation in the body, because it kind of leads to systemic inflammation, or what's called accelerated biological aging. I've heard the term inflammaging, which I really like. Inflammaging is this idea of accelerated biological aging that leads to degenerative diseases, and I say premature fertility decline. So we can regulate the inflammation in the body. Chronologically, you may be 40, but biologically, you may be behaving 50. Can we get you chronologically and biologically at 40 again? Because 40-year young women can have babies. And so regulating inflammation is what, in my opinion, probably one of the most important part of this mechanism with laser. The mitochondria is very important. The blood flow is very important. I think the chronic, its ability to regulate inflammation can have some of the most health benefits. And I hope to see that in the future if that comes to fruition, if that's the reason. So inflammation is like your pH, your soil's off. It softens adhesions and scar tissue. Let's see if I can point to this. Yeah, it softens. So again, this is pulling out the weeds. You got contaminated soil, you got rocks in the way. So we want to remove those obstacles so this plant can flourish, so the roots can flourish. And so using laser to soften adhesions, soften scar tissue, bring down that oxidative stress. This is us pulling the weeds and contaminated soil from your garden. And this is the kind of the main idea. What else I have there? It improves the absorption of nutrients like CoQ10. So this is adding more fertilizer. Again, I want to emphasize that to reach your peak fertility potential, there's diet, lifestyle, and the lifestyle includes rest, exercise, stress reduction, sleep. These are really important to keep the blood flow going, keep your mitochondria happy, reducing that inflammation, oxidative stress. On the acubalance.ca website, I published a fertility diet about 10 years ago, and then December of 2020, we republished it. I got together with our naturopathic physician, Dr. Kaylee McIsaac. We improved on it, and we also have added some more yummy recipes as well. Kaylee and I laughed that she liked the book I originally wrote, but she said the recipes weren't very tasty, and that's because I don't cook. So yes, the recipes were really fertility diet recipes. They're great for fertility, but man, they didn't taste great. And Kaylee loves to cook, and she can cook. And so we improved on the recipes. So now all the recipes are not only fertility inducing, but they also will taste good as well. So I just want to show some examples again. That blood flow is so key. Just looking at low-level laser therapy, what you're looking at here is up above at the very top. This is pre-low-level laser therapy. So this is what it looks like before the treatment, the front and the back. On the left is the front, and on the right is the back. And blue is lack of circulation, warmth. And the orange and red is blood flow, circulation. So this is this patient before treatment. After her first treatment, that slide number 2 or the picture number 2, that's what she looks like after just one laser treatment. And then at the bottom here, that's after 5 treatments. So you can see how there's a compound effect that having a series of laser treatments increases blood flow. And I will share with you that just in general, we're pioneering the fertility. So and I say this as in, we see people come to us saying, I tried laser for my back pain, my elbow pain, but it hasn't helped. But they were going once a week or every other week. And when I look at the research and what I know from my clinical experience, and pain's easier to measure because you can see it much quicker, the results, that 2 to 3 times in a week over the first 2 to 3 weeks. So we'll do 6 to 9 visits, but really close together. That's when we get the results. You get on top of it. And you can see here this compound effect. Same thing for fertility. In our experience, based on the research and the study and what they did in the Netherlands, is you kind of want to have a dosaging. And so once a week is more of a maintenance after you've done a series of treatments for maybe 2 to 3 menstrual cycles if you're not pregnant by then. probably by then you can slow down how often you're doing the laser. But at the beginning, we really want to get those mitochondrial function, get the blood flow going to support the environment, to support the body's innate ability to heal and self-regulate. And so we kind of want to give what the body needs, and then it kind of takes over, and then we're able to pull back and not see it so often. The biggest mistake I see when I get other clinicians, patients that have not had the results with the laser therapy is they had good lasers, they were doing good treatments, they just didn't have the dosage, so they never really got on top of the pain. And with fertility as well, it's the dosaging. It will be important. It will help a compound effect. Think of like exercise. If you exercise once a week versus 3 times a week for 3 months, once a week for 3 months, 3 times a week, your body's going to change differently. If you're studying for exam once a week versus 3 times a week for 3 months, you're going to get different grades. You're going to absorb more of that material. So it's kind of common sense that way as well. I just wanted to show this. This is not to gross you out, but I thought it was a great image here that I got from the group at Meditech, one of their lectures. This is somebody that was going to have her big toe amputated, had a diabetic, and this is due to lack of blood flow. She'd been to the wound clinic where they were trying to heal it, and it was now threatening amputation. They did multiple lasers over a 1-year period. I can't remember the number. It was either 40 or 80 visits in the first 8 months, but they saved her toe. So again, this is because look how it brought the blood flow, and then the body does the healing. If we can bring blood flow to an area, the blood brings nutrients, it brings those chemicals for healing, and it pulls away waste. And so if you don't have blood flow, we have cell death and risk of infection. And this is the same thinking of egg quality. We want blood flow to that area. We want to bring down the inflammation. And so I thought this was a great example of somebody saving their toe so much and showing you how effective it can be for blood flow. The bottom picture is somebody that had surgery, so on their ankle, and it's just showing you how it softens scar tissue adhesion. So look at the surgery over a series of treatments and how the scar softens. So I just wanted to show you some visual examples of what that looks like. It's important to circle back to the chronic inflammation, because I do think if we can help lower chronic inflammation, we're going to help reverse a lot of diseases, stop or reverse, like not just fertility. Look, diabetic complications, joint pain, cancers. They've even used low-level laser therapy in some COVID cases. We know COVID, some people have this cytokine storm, this major inflammatory storm. And laser is great for inflammation. So there was just a couple of case studies that were written up where they showed people that were in hospital having laser treatment where it made some changes. I do want to just state here, I'm not stating that this is a cure for COVID. I just wanted to give this in because nobody knows. It hasn't been tested that way. I just wanted to give you an example of how effective it is at regulating inflammation. I also want to say that at Acubalance, if you have COVID, we are not seeing you in our clinic. You need to go see the primary care providers that are taking care of COVID. So we are not at this time welcoming COVID into the clinic for the safety of our staff and all of our patients. So if you know somebody of COVID, just because I mentioned this, please do not send them to our clinic, because we will not be treating people with COVID. We will treat people post-COVID, but definitely not if they have COVID. And just going back to this, it's the chronic inflammation leads to accelerated biological aging, which can lead to premature degenerative diseases, and I say fertility decline. There's been studies now using it for endometriosis and pelvic pain. So we're seeing more and more research now coming out. In our clinic, we have seen women with endometriosis where we give them a series of treatments and seeing their pain diminish as well. So we're able to replicate what we're seeing in some of these studies. And so again, bringing down the inflammation, softening the scar tissue adhesions, just for quality of life, that's important. And then this also is important for optimizing somebody's chances of conceiving naturally, and still if they decide to go through the IVF route. Again, just another visual here about, so how good is it affecting inflammation and helping improve the cellular division and healing. This is somebody with rheumatoid arthritis. And look on the left, this is the same person. Look how deformed her hand is. And then
over treatments with laser, do you see how her finger straightened out? So I just want to share that the effect of this can be quite profound. In our practice, we've treated some people with rheumatoid arthritis where they're very difficult walking, getting up and down, and we treat them. This required aggressive treatment, several treatments over in a week, over several weeks, but they were able to start running and biking. So again, just to give examples of how effective this is for pain and inflammation. And when you have pain, endometriosis, you have inflammation, this impacts your fertility as well. I'll share a case just with PCOS because of the inflammatory effect. So PCOS, polycystic ovarian syndrome, some of these women have ovulatory disorders. They'll have some blood sugar dysregulation and high androgens. Some of the syndromes related to polycystic ovarian syndrome. And so if you have this hormonal imbalance, it can impact the egg quality, or if you have these high androgens in the uterus, it can impact implantation. And they've also linked, again, inflammation to polycystic ovarian syndrome. And this makes sense because that blood sugar dysregulation does lead to inflammation. Metabolic disorders leads to inflammation. And so I'm thinking of a woman that came to our practice, and she had already done IVF, and she had 2 unsuccessful transfers. The first one, it just didn't take. The second one, she had a chemical pregnancy. So she came to us to work with us for several weeks leading up to a frozen transfer was her idea to help with uterine receptivity. Now, she never had a cycle on her own. So to have a bleed, she either needed ovulation induction drugs, so letrozole or Clomid, or a progesterone withdrawal sometimes to make her bleed. Otherwise, she was kind of dormant. She would start to grow follicles and then they would arrest, they would stop. One of the common symptoms of PCOS, polycystic ovarian syndrome. So we started treating her. Now, again, I want to share, it's not just laser. We worked on her diet. So we put her on the Acubalance fertility diet, no calorie counting. We put her on supplements that we use for blood sugar regulation, for the inflammation, for improving mitochondria. She went through acupuncture and laser therapy 3 to 4 times a week. Now, we did this and she started to see changes. So she delayed her frozen embryo transfer. She lost close to 20 pounds without calorie counting over a 3.5 month period. She shared that she was depressed, but her mood shifted. Her hirsutism, so having hair where you don't want it, she noticed that it was changing. Her skin, her acne disappeared. And so she started to see these changes in her body, which motivated her to continue on before she did the frozen embryo transfer. And we shared with her that if we're able to help regulate her hormones, then she may actually start to ovulate on her own, and then she can choose to try to conceive naturally and leave that embryo on ice. And that's what she did. And she ended up ovulating and conceiving naturally. And she's already had her baby. So we used the laser, but we did laser, acupuncture, diet, supplement, stress reduction. It's very integrative. So our patients, we're always doing an integrative process. There's nothing like you just need to do this. It definitely is integrative. One of the most common questions I have is, so what laser can I use? Who else is doing this? There's Australia. I know of a clinic doing it in Australia. We're here, the ones in Canada. In Denmark, there's a few clinics. It's still being pioneered. And the reason why probably a lot of clinics haven't adopted it yet, some are waiting for the robust research that is not available yet. Also, it's cost prohibitive. To get a laser that you're going to use for fertility that's effective, they're quite costly still at this time. There are tons of lasers on the market that are not costly, but they probably don't have either the right wavelength or the right power to do it in a 45-minute to an hour treatment. So some of the clinicians, when they used to call me to say, I have this laser, can I use it in my clinic? I would tell them they have to hold it about a half an hour per point. Well, they said, that's not feasible. I don't have 3 hours for this patient. So most of the clinicians, it's just cost prohibitive. We've invested in several lasers at Acubalance. And so I'll share with you the quality of laser is important. So the power, why? The dosage, how many photons can we get to the pelvic bowl? How many photons energy can we get to the light in a reasonable amount of time? Is it the right wavelength? Can we change or play with the frequency? Some skill related to the practitioner. And then treatment schedule matters. If you're doing it every 2 weeks or once a week versus 2 to 3 times a week, you're going to get different effect, different results. So often and I know there's several practitioners on here. I've been doing this for several years, and I have a lot of lasers. I've spent a lot of money on lasers because there is no one laser that I have found that does it all, right? That I like. So I have several lasers for different things, different parts of the body I want to use. But the question I get, so I'm going to answer it, is if I was starting today, what laser would I get? And so I put some of them here that if I was starting today, and if you're looking for somebody, I guess this could be some of the clinics you would like to see. The paramedics, that's the one on the left, that's called the Giga laser. It's pretty idiot proof in that it has a couple of programs. You just need to put it over the abdomen like they did in Denmark and press the program and it's good to go. And it has a big surface area. It's got the right wavelength and it's got the right power. And anecdotally, those clinicians shared their great results. So that's a great laser to start with. It's probably the most expensive laser that I've seen out there for what we're using. So it's cost prohibitive. We're fortunate at Acubalance that we have one on loan in our clinic because they came for a conference that got canceled. So they couldn't take the laser back and they're letting us use it in our clinic here and there. So we have one of those that we're playing with in our clinic. So that's paramedics, the Giga laser on the left. And so that one is simple, set, ready to go. It's easy. It's so easy. Then the other one by the the paramedics people is the center one. And I would recommend the Pro 1500 if I was starting today and get 2 of them. And then there's a whole sequence that you want to do around the neck and the occiput and on the abdomen and over the vertebrae, they innervate the ovaries, and over the vertebrae, they innervate the uterus. So, but with that, with two of these probes, you can, within a short period of time, definitely within your half an hour, if you're putting acupuncture in the needles, you can get to all these body parts and get a dosage in there. So the Pro 1500s, and that is not super cost prohibitive compared to the Giga. In our clinic, we have also the BioFlex. I like the BioFlex, it's the arrays, but I like a more powerful probe. And so we use the BioFlex. So our patients know we use those arrays. That's the one on the far right. So we use these arrays and we put those on the abdomen and the sacrum. So we ended up investing in 2 arrays per our room. So we get one on the front and the back. And then we use our probes to do these other areas of the body. And again, it's just because the BioFlex probe isn't strong enough to get the dosage I want in the amount of time I need. So if you're seeing a practitioner and they're spending several minutes with you and they're doing stuff around the neck and they're doing stuff in the ovaries and over your back, then they're probably on the right track. That's what they're doing in Japan. That's what we're doing. And if they have the right laser, then you could be in good shape. If it's a weak laser, then it may not do anything because it's not strong enough. And again, as I mentioned, the Giga laser on the left is set and ready to go. The Pro 1500s, you would need some education on that to how to use it, but definitely not overly complicated to use that. And then the BioFlex is a great system. We use it for so many things, including fertility. So the question I'm answering here is, if I was starting today, the BioFlex and the Pro 1500s I like, or you can just do the Pro 1500s, or you can just do the Giga. And so hopefully that helps you with kind of what do you recommend for lasers. I do want to share another story with you, just kind of what we've seen in our clinic and why I'm continuing to pursue this and hoping to see more research or be involved in research. But I think of a case where she came to us late 30s. I think she's 39. I should have just reviewed this before I did this webinar, but let's go with 39. And she had just done an IVF and she had them genetically screened, and all 7 embryos that she sent away for testing were abnormal. So nothing to transfer. And obviously she was quite devastated. So we started to do regular laser acupuncture with her. So laser and acupuncture combined in the visits. We did supplements. We did dietary therapy, naturopathy as well with her, some mind massage. You see, it's integrated, right? It's not just one thing. And I did some of my baby manifestations, so the hypnosis, belief change work that I do with patients. So we really did the mind body on this. And her goal was to work with us for 6 months and then try another IVF, see if we can make a difference with egg quality. And during that 6-month period of working with her with this integrative approach, she conceived naturally and has already given birth. So from doing an IVF, 7 embryos sent away, none are normal, to conceiving naturally. And again, that's the integrative approach. If you're looking for other resources at Acubalance, I want to let you know that we have a YouTube channel. Just search Fertility Now. I'm basically dropping a very short tips on fertility once a week, so you can see a series of them there. I try to keep them short, and they're definitely simple. There's the Acubalance Fertility Diet that you're welcome to download for free as well at the acubalance.ca website. And if there's any other questions, I will take some of those right now. I'm just going to look to see what's coming in. And I want to thank you guys for sticking around and joining this thing. Do you work with a specific fertility clinic? Yes. So in Vancouver, so I was involved in getting acupuncture on site at all the IVF clinics in Vancouver. So back in 2002, I got that process started. Now the clinics, it's like how doctors have hospital privileges. Every IVF clinic kind of has their acupuncture group that just goes on site for them. So we go on site only for Olive. So we're the only acupuncture group that can go on site at Olive. We'll see people that are going to other clinics. And so we'll see you at our clinic, but we can't go on site for that other clinic on transfer day. With Olive, what's worked really well is the integration. So we have that relationship where we're communicating with your IVF reproductive endocrinologist doctor, and we discuss what we're doing together. So it's been really nice having that integration where we're working preconception, so leading up to your IVF, during your IVF, and then we go on site on transfer day. I will share with you when people say, so what's the schedule for treatment? What we're doing at Acubalance, the ideal, if take time and money out of the equation, I'd recommend for 3 cycles, 3 times a week in the follicular. That would be ideal. A lot of our patients will do twice a week throughout the cycle, but 3 times a week I think would be ideal leading up to ovulation. What I didn't mention in the Japan group, remember Dr. Nakamura, where he was doubling the blastocyst rate. So people that had unsuccessful IVF cycles, then did some laser treatments. When they did the future IVF cycles, they had an increase in how many embryos grew to day 5. I asked him how long he's treating his patients. And he says if they're not pregnant, whether naturally or IVF after 6 months, they see a large drop off, meaning these are just complicated, difficult cases and they're not getting them as many pregnant. He says most of the pregnancies they see occur within 6 months. And it's common for women to have at least 3 cycles, 3 months of treatment. So just to let you know, that's common. So in our clinic too, if you're looking to do this with somebody, you're looking to 3 to 6 months to help prepare and support your egg quality. And we see people coming in at all different stages of their fertility journey and their IVF cycle. So I had somebody just last week, they're starting their stims. They just started their stims yesterday. And so we started her right away. So we're going to do twice a week leading up to her retrieval. So wherever you're at, wherever you're at, we start you. And in an IVF process, twice a week leading up to retrieval, we do the AccuLaser. And then if you're doing frozen, we do twice a week leading up to retrieval as well. And ideally, we want to start you just before you have your bleed, but definitely by your estrase. So if you're doing a frozen and you're looking for the acupuncture and the laser acupuncture for improving uterine receptivity and endometrial receptivity, and what we're currently recommending is at least once you start estrase twice a week, and that gives us at least on average 6 visits before you have your transfer, and that's for a frozen. And for retrieval, it's similar, twice a week leading up to retrieval. Have you seen many results with patients that have gone through multiple fresh IVF cycles with abnormal embryos and have success after? Yeah, I just shared one of those cases. So we have seen people where it's changed. We have seen AMH go up as well, which is a nice thing to see. So yes, we have. I want to be clear here that it's not the Holy Grail. So I've seen a lot of people where it doesn't do anything either, right? So I haven't found anything that works. Just like I see patients that have done PGT testing, the chromosomal screening, and the embryo doesn't stick. What's going on here? It's a normal embryo. And then they do the ERA. And now when they do the ERA, now we see higher success rates, but still not 100%. So nobody has gotten like, you do this, you're going to get pregnant. There is no right way to do this. There are things that you can do to optimize to help you reach your peak fertility potential. And there's a cost benefit. There are people come with their supplements, and it gets to a point that every time you add a supplement, yeah, it can help. But the having to take one more pill, the benefit of that one extra antioxidant, the time and the money to take it, may not have as much benefit as you would desire. So there is that too little is too little and too much is too much. Can fallopian tube scar tissue be softened with laser treatment? Possibly open the tubes? Great question. Don't know that yet, right? Nobody's done a study on that. We've seen it soften endometrial tissue, endometriosis and scars. So not that they've seen it soften the endometrial scarring. It's not like they did a lap before and after, just that women had lots of pain, and after laser therapy, their pain is reduced or gone. And so I don't know. I'm optimistic for that because that's why we like to do it over the abdomen. Again, if you have scarring or blocked tubes, still IVF to me is in living it. We're filming this December 2020. I'm a fan of just whatever works. Let's use what works. So I still think IVF is the best tool for any tubal issue. Obviously, there's inflammation or scarring. If we can lessen that, that's great. And that's where you can get some mind massage. So if you came to me saying I have some tubal issues and you wanted to conceive naturally or with IVF, I would still want to have that laser over your abdomen, over the fallopian tubes. And I'd also be recommending you do mind massage and some other supplements for that. And again, we offer mind massage now at Acubalance Wellness Centre. Is there any contraindications or negative side effects for laser? If you're using low-level laser therapy, so these aren't the high-powered ones that can get hot or burn you or cut you, low-level laser therapy. The main side effect or the risk factor is if you stare at the laser beam, you can damage your eye because with infrared light, you don't see it, so you won't blink. But again, I use acupuncture needles, and if you take one of my needles and stick it in your eye, you're going to damage it as well. So just as I don't expect somebody to take one of my needles and put it in their eye, I don't expect somebody to grab my laser and put it in their eye either. Most people, you'll have glasses that you can wear during your laser treatment, or you definitely have your eyes closed. Most of the low-level laser therapy systems, a lot of them are divergent beams. I'm going too technical here, but even if you look at it a bit, it's probably not going to damage it. But to answer that question, minimal to no side effects to laser therapy. Sometimes people feel a little fatigued if you're doing stuff on the head, but in general, people feel pretty good. If you're using it on pain and stuff, it's kind of like an overtreatment. If somebody has a really chronic injury, sometimes it can feel worse for 24 to 48 hours before it feels better. That's not necessarily a bad thing. We just brought blood flow to the area. We're turning on that healing response. And so it's kind of like all those symptoms start to go in reverse. So now that you have this frozen shoulder that hurts when you move it, and we start to laser it, all of a sudden we start to soften things up, things start to move, chemicals are being released, and you get a little sore after it. Not necessarily a bad thing. But in general, minimal to no side effects. The main thing is damaging your eyes. We don't put it on a fetus. So if you are in your luteal phase, if you've done an IVF, then it's contraindicated to put it over your uterus or over your sacrum, just because we don't put it over a fetus. Not because there's any concern in that, it's just that we don't know. Nobody's done research on it. But from the laser perspective, it shouldn't cause problems for light therapy, but we don't do it because we don't know. Could I ask where you focus laser probe for fertility after the rays on the lower back and abdomen? It's a little bit technical, but we do have certain parts of the body that we do it over the ovaries, phthalate ganglion, vertebral arteries, occiput. There's certain vertebrae nerves that go and innervate the ovaries, and certain nerve roots from the spine that innervate the uterus. So this is something that we've developed for a while and are targeting certain features and certain acupuncture points that we know have a physiological effect on the body. I don't know anybody in the East Coast who's doing this. You can contact, we get calls, and basically what I'm telling my colleagues is, look, really you want to get a good laser to start with. So contact the group at Paramedics. If you really want the simplest, easiest, the Giga laser. It's really, it's a price tag, but it has some good results based on the Denmark group. And it's really easy to use, and you can treat a lot of things with it, not just fertility. So that's where I would start with. I think I may set up a course for my colleagues. It's difficult for me to do these one-on-one things. I was doing it at the beginning, but because of my busy schedule and I want to take care of my patients, I'm just not set up to take these phone calls to do training over the phone. So I probably will organize something. Pre-COVID, people were flying to Vancouver from the Middle East, from the States, Eastern Canada, and they would spend a week at our clinic and get treated 3 to 5 times in a week, where we did nutritional IV, mind massage, a series of acupuncture and laser treatments, etc. during that week. COVID kind of stopped that. And realistically, that's a big expense and that's a lot of stress. So at this stage, it'd be nice that other people start to use it. So encourage your practitioner to invest in themselves. That's what we did at Acubalance, and get good lasers to start. And then it will get easier if they have a good laser. Does the laser help reduce endometriosis tissue and scarring? We do know that there is research out on laser for endometriosis. So it has an anti-inflammatory effect. It brings down inflammatory markers, and it's known to soften scar tissue and adhesions. I'm not sure yet about what is it doing to these implants, but if your pain is going away, maybe it is. But we don't know. Like, nobody's done that kind of research yet. We definitely can see that it's bringing down the pain. And this is important because if you have all these inflammatory chemicals in your body, this is not good for egg quality. This is not great for uterine receptivity. This is not great for lifestyle. So if you have a lot of scarring, adhesions, I still think it's the laparoscopic surgery to remove that scarring. And then laser therapy, anti-inflammatory diet, anti-inflammatory type supplements. You're using this to make sure this endometriosis hopefully doesn't grow back and to keep that inflammation down. And so this is where it's integration. So if you know you have a lot of scarring and endometriosis, then sometimes surgery is a great way to get rid of that scarring if it's structurally interfering with your fertility. And then definitely from the physiological aspect, the low-level laser therapy's anti-inflammatory effect would be beneficial as well. Listen, I want to thank you guys. Those were great questions. Please check out the Fertility Now YouTube channel and check out acubalance.ca for that fertility diet. And if you live in the Lower Mainland in the Vancouver area, we offer 15-minute free discovery calls over the phone to see if we're a right fit, and happy to chat with you and to see if you're somebody that we possibly could help support you. I'm wishing you the best of luck on your journey. If I could summarize the take-home message here is: nourish the soul before you plant the seed. Laser therapy is not the holy grail. So if you don't have it where you are, deep breaths, you're okay. You got diet, you got lifestyle, you got supplements, you got acupuncture, you got herbs in your area for sure. That stuff is excellent for optimizing the fertility. It's excellent for nourishing that soil, for that cellular environment. And then if somebody is using laser therapy and they're using it in an effective way, they got a good laser and they're spending some time with you, and you're able to come in 2 to 3 times a week, especially in that follicular, then it's just an added thing you're doing to your soil. If you don't have the laser, it doesn't mean it's the end all. We've been helping people get pregnant well before we used the laser. And so it's just another thing that we're doing to help support your soil. So again, nourish the soil before you plant the seed. And thank you for your time, and thank you for tuning in and asking your questions. Much appreciated.